So the first thing let's start with is looking at the difference between using a pregnancy belt and taping. And so you can see the difference of the benefits of having a tape job that's completely customizable to your client versus the pregnancy belts is really only a one size fits all. All right, Laura, this is one of the most common pregnancy belts. As you can see, it's quite complicated. I want you to see the difference between putting on a pregnancy belt versus the tape. So I'm gonna guide you through this because there's multiple pieces. And a pregnancy belt really is only good for one or two things. It's one size fits all. It's really only good for SI compression or sometimes in the pubic bone in the front. So this one goes in the front. Comes around the back. I'll give you a little assistance. See, already it's complicated. Again, I guess that goes up below the shelf of the belly. So this one's just for this one doesn't do anything. This is the one that kind of cinches your waist in the SI area. So grab this side here, and then pull it forward as far as you can comfortably go. Good. And next time you turn so the cameras can see that when you just decide that a belt is supposed to kind of cinch into like the base of the sacrum into the lower back as well. And this fancy belt, again, being one of the most popular ones on the market, has a diaphragm belt. It's supposed to help with diaphragm and like acid reflux. But as you can see in the belt, it doesn't do a whole lot. I mean, maybe for a bit of comfort, but there's not a whole lot of tension here. All right, so that's belt number one. So now we have this other belt that's often used in pregnancy. I don't have Laura doing it for me today just because she's having twins, so it doesn't fit her. So this is more so for SI support. So when you put it on, you want to make sure this is done up below your belly shelf. And then you have these adjustable pieces are at the back, and then you cinch them together as far as you comfortably can. And what this does is it cinches together the SI joints. But depending on how pregnant you are, this really is very limiting. It's going to put a lot of pressure on the baby's head if it's down, and it's not going to give you any broad ligament support. This belt is really just for SI support. So this is kind of where we roll into some of the taping, which is customized, where this is only one size fits all. So before you start any tape job, you want to make sure that you do a test patch, because even though they don't have a latex allergy, I like to use the inside of their wrist. And I just slap on. You can use one on the belly if you wish, but just because they're not allergic to latex does not mean that they might not have a systemic reaction to the tape. So you're looking for itchiness, burniness, even red around the tape, and make sure that you set this for at least 10 to 15 minutes. So I often will put this on first, do my assessment to see what's needed in the client first, and then make sure that they pass the patch test first before I go ahead and tape them. So the first taping I want to show you is actually a taping product, which is more user-friendly when they're on their own because they might not be able to tape themselves. So it's called spider tape or tummy tape, and it's actually already labeled. It's user-friendly, it's got numbers on it. And let's show you how easy it is for the pregnant individual to apply it themselves, which is great for when they can't have you to do it for them. All right, Laura, I'm gonna send you home with this piece. This is one I use in my practice a lot. It's called spider tape. It's called tummy tape. They've changed the logo since then. So this is an easy application I use in my clinic to give clients for home care if they can't, because sometimes taping, I wouldn't want them to tape on their own, as it can be a liability if they don't do it right. So this is a nice way to use instead of the pregnancy belt. So it's nice, it's numbered. You've got 1 on the bottom, 2's here, and then 3's on the outside. So I'm gonna have Laura apply it, and I'm gonna talk her through it. So just to see how easy this application is, that she can do it at home to help with broad ligament pain. So let's see your belly, and I'm gonna, so if you can just move your pants down just a little bit, right, that's perfect. So how it's numbered, you're gonna put the number 1 piece, you're gonna just put it underneath the shelf as much as possible, and it just rips really nice and easy. I'll let you rip the last one. Perfect. And then you're gonna take the number 1 piece off, and you're gonna just apply it on the bottom aspect of your belly as low as you can get it. Perfect. And then just rub it down a little bit. Perfect. And then the second one, you're gonna take off tape. So the tape can roll, so kind of make sure you have a good hold of it, like when you take off the piece. Perfect. Hold it for you so it doesn't. and then actually I want you to do both at the same time. So then take off the other one. You can do it one at a time, but I prefer 2 at a time so you can get an even lift. So now to get a good hold, I want you to, then now you're just going to lift up as high as you can comfortably go, and then come back a little bit so you don't have so much tension on the tape. Right there is perfect. And you're just gonna lay it down and then just give it a little bit of a rub. So at home, it's not too bad. So right here, you can see that she's got a few wrinkles on the tape. So if you get the tape right away, it's not as sticky, and you can fan those wrinkles out. And then do number 3. This is going to help with broad ligament pain, even a bit of that round ligament pain. It's really comfortable for any kind of bladder pressure as well. So those ones are going to kind of fan up. You can go a little bit out wider if you wish, but even like on a oblique angle right there is good. And then pull up a little bit and then come back down. Good. And then you can wear this up to 2 days. Some people wear it for 3. 2 is best. If you get any irritation, you just take it off.